Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Signs of a blood clot in the arm. A blood clot in the arm could lead to serious complications. One type of blood clot, deep vein thrombosis, DVT, forms in the deep veins in your arm or leg. It can cause pain, swelling, and skin discoloration. /r/n/r/n In some cases, a DVT clot can break off and cause a pulmonary embolism, PE, a blockage in the lungs artery. This is a life-threatening condition that can cause damage to the lungs as well as other organs. /r/n/r/n If you suspect you have a blood clot in your arm or anywhere else, you should seek immediate medical care. Most blood clots are treatable, and complications can be avoided if caught early. /r/n/r/nSturti, Getty Imagesrnrn A blood clot will form to stop the bleeding when you get a cut. But sometimes, the blood in the veins forms a clot for no reason, which can be harmful. /r/n/r/n The three types of blood clots include /r/n/r/n When a DVT affects the arm, it is sometimes called DVT of the upper extremities, DVTUE. Of cases of DVT, 11% to 14% are DVTUE. Most blood clots of the arm occur in the upper arm. /r/n/r/n It is possible to have a blood clot in your arm and not experience symptoms. Around 33% to 60% of people with DVT in an arm do not experience symptoms, especially early on. For most people, symptoms will come on gradually. /r/n/r/n Symptoms of DVT in the arm might include /r/n/r/n Additional early symptoms might include weakness or paresthesia, numbness, tingling, burning, etc. in the affected arm and elevated body temperature. But those two symptoms are rare. /r/n/r/n Early signs will intensify, especially pain, swelling, and cramping. If DVT breaks loose and travels to the lungs or restricts blood flow, you might experience PE. PE can be life-threatening. /r/n/r/n Signs of PE include /r/n/r/n You should seek immediate medical attention if you believe you have a blood clot in your arm or another body area. /r/n/r/n A blood clot in the arm is either primary or secondary. You may be more at risk for one or the other depending on your condition. /r/n/r/n Primary DVTUE is rare and might occur because of repeated or strenuous activity using the arm, such as weightlifting or rowing. Most clots resulting from strenuous activity occur in the dominant arm. /r/n/r/n Secondary DVT accounts for 80% of all DVT cases in the arm. It occurs because of a disruption in the vein leading to a clot. /r/n/r/n Such disruptions include /r/n/r/n The highest risk for a DVT to break off and become a PE is in the first few days. Factors that might increase your risk for a DVT to produce a PE include /r/n/r/n If you notice signs of DVT, you should seek immediate medical attention by heading to your local emergency room. A PE can occur quickly and within several days after the blood clot forms. Getting prompt medical attention is the best way to prevent this complication. /r/n/r/n You will be asked about symptoms at the emergency room, and your arm will be examined. If a blood clot is suspected, imaging will be requested. /r/n/r/n The most common diagnostic test for DVT is a duplex ultrasound. This test uses sound waves and Doppler technology to visualize blood vessels and blood flow. If a PE is suspected, a healthcare provider might request other imaging, such as a chest X-ray or a computed tomography, CT, scan. /r/n/r/n Once a diagnosis of DVT is made and a treatment plan is set in the emergency room, ER, you can complete treatment at home. You will also need to follow up with your primary healthcare provider. But if you are diagnosed with PE, you will likely be admitted to the hospital for treatment and monitoring. /R/N/R/N The primary goals for treating DVT in the arm are to stop the blood clot from increasing in size, relieve symptoms, and prevent the clot from traveling to the lungs or another body area. /R/N/R/N Treatment options for DVT in the arm include /R/N/R/N Additional treatments for a blood clot in the arm are limb elevation and a compression arm sleeve. Elevating the affected arm can help reduce swelling and pain. A compression arm sleeve can help improve blood flow from the arm to the heart. /R/N/R/N The body will naturally absorb the clot over weeks and months. As the clot dissolves, symptoms of DVT or PE will improve and eventually disappear. /R/N/R/N You should start to see symptom improvement within a few days of using an anticoagulant or thrombolytic. Recovery from PE or DVT usually occurs within a few weeks or months without any serious complications or long-term effects. /R/N/R/N While rare, it is possible to experience long-term pain and swelling in the affected arm. About half of the people with DVT will have some chronic discomfort, and around 15% will experience post-thrombotic syndrome. This syndrome results from damage done when the clot forms and scarring from the obstruction. It causes long-term pain and swelling. /R/N/R/N Around 2% to 4% of people will experience lung damage, known as chronic thromboembolic pulmonary hypertension. This complication causes shortness of breath and decreased exercise ability and can lead to heart failure if untreated. /R/N/R/N While complications and long-term effects are rare, completing your treatment and seeing your healthcare provider for follow-up visits is essential. Contact your healthcare provider if you still have pain and symptoms after you have completed treatment or if treatment does not appear to be helping. /R/N/R/N Deep vein thrombosis occurs when there is a blood clot in one or more of the deep veins in the body. While DVT often develops in the leg, it is also possible to experience DVT in one of your arms. Causes of a DVT in the arm might include trauma, surgery, or central venous catheter use. /R/N/R/N If you have signs of DVT, head to your nearest emergency room. A pulmonary embolism, a complication of DVT, can occur quickly and within a few days. Getting immediate medical attention can prevent PE. /R/N/R/N Treatments for DVT include blood thinners and clot-busting drugs. An inferior vena cava filter or surgery might be required when medicines are not enough to clear a blood clot. /R/N/R/N Recovery from DVT should take many weeks or months, but complications are rare. You should contact your healthcare provider if treatments do not appear to be helping or if symptoms worsen. /R/N/R/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.